Welcome to our exploration of ivermectin, a medication that has gained significant attention in recent years. Ivermectin was discovered in 1975, isolated from soil bacteria called Streptomyces vermiculus. Its discovery was so significant that it led to a Nobel Prize in Medicine in 2015. Ivermectin belongs to a class of medications known as macrocyclic lactones. It's a semi-synthetic compound with a unique ring structure, and it's highly lipophilic, meaning it dissolves well in fats. Ivermectin has broad applications in both human and veterinary medicine. In humans, it's primarily used to treat parasitic conditions like river blindness, strongyloidiasis, scabies, and head lice. In veterinary medicine, it's widely used for heartworm prevention, treating intestinal parasites, controlling mites and ticks, and managing parasitic infections in livestock. Ivermectin has had a profound global health impact. It's listed as a World Health Organization essential medicine, with approximately 250 million people receiving treatment annually. It's especially critical for combating neglected tropical diseases in developing regions. In recent years, ivermectin has gained significant public attention, particularly during the COVID-19 pandemic. While it's the subject of ongoing research for potential antiviral properties, it's important to distinguish between its approved medical uses and unapproved applications. As with any medication, it's crucial to follow medical guidance from healthcare professionals regarding its use. In summary, ivermectin is a versatile antiparasitic medication with well-established uses in both human and veterinary medicine. In the following sections, we'll explore its mechanism of action and specific applications in more detail. Ivermectin works by interfering with the nervous system of parasites. It specifically targets glutamate-gated chloride channels found in invertebrate nerve and muscle cells. The first step in its mechanism is binding to these channels. When ivermectin binds to these channels, it increases the cell membrane's permeability to chloride ions. This influx of chloride ions causes hyperpolarization of the cell membrane. Hyperpolarization paralyzes the parasite, ultimately leading to its death. Ivermectin also disrupts GABA-mediated central nervous system neurotransmission. GABA is an inhibitory neurotransmitter in the central nervous system. By interfering with GABA signaling, ivermectin further impairs neurological function in parasites. Through these dual mechanisms, glutamate-gated chloride channel activation and GABA disruption, ivermectin effectively paralyzes and kills parasites while having minimal effect on mammalian cells. Ivermectin pharmacokinetics describes how the drug moves through the body after administration. Let's examine the 4 key processes of pharmacokinetics: absorption, distribution, metabolism, and excretion. After oral administration, ivermectin is rapidly absorbed from the gastrointestinal tract, reaching peak plasma concentrations in approximately 4 hours. Ivermectin is highly lipophilic, meaning it dissolves in fats, allowing wide distribution throughout the body tissues. It has a volume of distribution of 3 to 3.5 liters per kilogram. Importantly, ivermectin does not readily cross the blood-brain barrier in mammals, which contributes to its safety profile in humans. Ivermectin is primarily metabolized in the liver through various enzymatic pathways. The drug and its metabolites are primarily excreted in the feces, with a half-life of approximately 18 hours. With a half-life of 18 hours, half of the active drug is eliminated from the body within this time period. In summary, ivermectin's pharmacokinetic profile includes rapid oral absorption, wide tissue distribution due to its lipophilic nature, limited blood-brain barrier penetration, liver metabolism, and primarily fecal excretion with an 18-hour half-life. Ivermectin became a subject of significant controversy during the COVID-19 pandemic. Let's trace how this controversy developed over time. Early in the pandemic, laboratory studies suggested ivermectin might have antiviral activity against SARS-CoV-2. This led to numerous clinical trials between 2020 and 2025 with highly variable results. Meta-analyses of these studies have not shown consistent evidence that ivermectin is effective for COVID-19 treatment. As of 2025, major health organizations, including the World Health Organization and the FDA, recommend against using ivermectin for COVID-19 outside of clinical trials. Beyond its antiparasitic and potential antiviral applications, ivermectin is being explored for several other therapeutic purposes. Research is examining ivermectin's potential anti-inflammatory, antibacterial, and anti-cancer effects. In cancer research, ivermectin has shown promise in inhibiting tumorigenic cell proliferation through various pathways. It has also demonstrated the ability to induce autophagy, a form of programmed cell death, in various cancer cells. Autophagy is a cellular process where cells degrade and recycle their own components. Ivermectin appears to enhance this process in cancer cells, leading to their death. However, these anti-inflammatory and anti-cancer applications are still areas of active research. Preclinical studies show promising results, but more clinical trials are needed to validate these findings. Ivermectin is a common treatment for scabies, a skin infestation caused by the mite Sarcoptes scabiei. Both oral and topical formulations of ivermectin are available for treating scabies, each with distinct advantages. Oral ivermectin is often administered in a 2-dose regimen to maximize effectiveness. The first dose kills the adult mites, while a second dose, given 7 to 14 days later, kills newly hatched mites that were previously eggs. Both treatment options have shown high effectiveness rates. Oral ivermectin shows a 95% cure rate with the 2-dose regimen, while topical formulations achieve 85 to 90% with a single application. A notable case study demonstrates ivermectin's effectiveness in managing institutional outbreaks. In a nursing home outbreak affecting 42 residents, mass treatment with oral ivermectin achieved 95% resolution within 2 weeks. This case illustrates a clear and effective application of ivermectin for a specific parasitic condition, with advantages in both clinical outcomes and cost-effectiveness. Expert opinions and health authorities have issued important warnings regarding ivermectin use. Experts strongly caution against using veterinary formulations of ivermectin for human use. These products may contain ingredients unsafe for humans, often have much higher concentrations, and are not regulated for human consumption. It's crucial to follow approved guidance from health authorities like the CDC, FDA, and WHO. These organizations provide guidelines based on scientific evidence and clinical trials. During the COVID-19 pandemic, ivermectin prescriptions increased dramatically due to misinformation and mistrust in scientific institutions. This highlights the need for policy reforms to combat misinformation and promote evidence-based treatments. Key recommendations include improving health communication strategies, developing clear guidelines for off-label drug use, and promoting evidence-based treatments. Always consult a healthcare professional for appropriate medical advice before taking any medication, including ivermectin or any other prescription drug. The future of ivermectin research expands beyond its traditional antiparasitic applications. Researchers are now exploring 3 major frontiers: antiviral applications, anti-cancer mechanisms, and innovative delivery methods. In the antiviral realm, scientists are working to validate the promising in vitro findings with rigorous in vivo studies. These studies will help identify the therapeutic window and explore potential combination therapies with existing antivirals. For cancer applications, researchers are investigating how ivermectin interacts with key cellular pathways. Studies show that ivermectin can block cancer-promoting pathways like PAC1 inhibition and Wnt-baccatenin signaling. It can also induce autophagy in cancer cells, making it a potential adjunct to existing cancer treatments. Innovative delivery methods are also being explored to optimize ivermectin's effectiveness while minimizing side effects. Intranasal formulations show promise for respiratory infections, while modified release tablets and targeted delivery systems could enhance its therapeutic index. The future of ivermectin may see its evolution from an antiparasitic drug to a multi-purpose therapeutic, with applications in emerging diseases. It might also serve as a platform for developing novel drugs that target similar biological pathways with enhanced efficacy and safety. As research continues, the versatility of this remarkable drug reveals new possibilities for addressing diverse medical challenges.